So I'm just going to give it another minute or so for people to sign in and join us. Anyone who's just joining us, if you can just pop in the chat just who you are and where you're joining us from. And it's brilliant to see that we are getting people from all over the UK, even the Isle of Wight. That's brilliant. I don't think we had anyone from the Isle of Wight last week. So it's really good to see that we've got people joining us from all over, and I'm recognising some names from people who joined us last week. So that's brilliant that you've come back. We obviously didn't scare you off or anything. Hi, Ross. Yes, you guys are on mute, but you can use the chat function to chat to each other. Right, so I'm just gonna sort of make a start now this morning, and if people just keep using the chat, we're going to be monitoring that throughout. But thank you everyone for joining us. Some of you may have joined us last week when we did stuff around sort of underlying principles last Tuesday and last Thursday when we had a bit more of a breakout session. Some of you may not, and a week ago seems like an incredibly long time, especially in the world at the minute with everything that's happened in the past week. But thank you for those of you who are joining us again, and those of you who weren't with us last week but are joining in for this week. Today we're doing sort of a bit of a session around multi-agency working, and we've got presenting for us, we've got Doug Gibson from Homelessness Network Scotland, and then we've got Ray Clark and Lauren Wallace from SHP. I'll let them introduce themselves when it's their time to present, because they'll do a much better job of it than what I will. But just some little bits and pieces around this. So we are recording this and we will put it up on our website afterwards. If anyone missed the session last Tuesday, the underlying principle session, that's up on our website now, and we can post a link to that in the chat later today. This is also the third in a series of events that we're running. So we've got this one today on Thursday. We're doing a bit of a breakout session again. And then next week, we're doing another webinar session on a bit of harm reduction, a bit of staff wellbeing, with a breakout session on the Thursday looking a bit closer at staff wellbeing. Just before we start, I'm just going to launch some polls just so we can get a good idea of sort of just who everyone is and where people are coming from, and I'll share these out. So if you could fill these out, that'd be brilliant. So the first one is just sort of where in the UK are you based? England, Scotland, Northern Ireland, or Wales? I can see that most people have voted on that, so I'm going to end that and just share that out so everyone can see. Most people from England, that's not surprising. We've got a couple of people from Scotland, so Doug, there might be one or two people that know you here. Northern Ireland and Wales, so again, that's really good that we can see we're getting people from across the UK. Next question, we just want to see what sector people are working in, whether you're from a statutory service, public, or sort of VCS. And most people have voted on that, so I'll share this out as well. And again, I don't think it's surprising that most people are from the voluntary and charity sector, but again, it's good to see we've got a couple of people from statutory service and public as well. That's really good to see. And then just the last one, and this is the last one, I promise. We just want to see if people work in a housing first setting or not in this. Cool, and most people have voted on that, so we'll share that out. And yeah, most people do, but there is quite a good number of people that don't. So thank you, everyone, for sort of coming along regardless of what setting you work in. I'm sure this will be helpful to sort of everyone. So what we're going to do, Doug's going to present for us in a minute, and then we will have a little break, and then we'll go to Ray and Lauren at SHP. But feel free to put stuff in the chat. And if you've got questions, there's also a Q&A box that you can use that you should see down the bottom that we can pull stuff out. But please also put stuff in the chat. I have got my colleagues looking at that for me as well, so things might get flagged up and passed over to me. And that's it from me. So Doug, I'm going to hand over to you.
Thank you, Joe. It's good to be here. I'm going to share my own screen if that's possible, just to open up a slide show here. Yeah, it's good to be here. It's strange to be here given that it's my kitchen, but good to talk with people across the country. That's one of the benefits of the past few months, has been able to connect with people nationally, internationally, much easier than before. I hope you're all well. I hope this today is something useful. The brief was to talk about multi-agency working in the context of Housing First. So given that many of you work in Housing First, I hope this isn't also teaching you to suck eggs at any point. A bit about where I'm coming from for this. So I work for Homeless Network Scotland. We work in kind of policy and system settings in Scotland, trying to connect everything that's happening on the ground, learning from best evidence, making sure that what's being developed is more of what works, less of what doesn't. Part of what we do is host and manage Housing First Scotland. And over the past 2 or 3 years, I've had the pleasure of programme managing the Housing First Pathfinder in Scotland, which we'll touch on later, which works across 6 local authority areas to try and scale up Housing First and to figure out some of the big challenges, questions, and laterally the solutions to those. So without further ado, if I can move on, to give some idea of the Scottish context, a summary of our challenges just now. So in the last recorded year, there was just under 30,000 homeless households. That's a 50% reduction over the decade, but in the past few years, it's also started to tick up again. Those numbers are obviously something we want to address. A third of homelessness in Scotland is focused in the central belt, mainly in Glasgow, Edinburgh, the 2 biggest cities, with 40% of rough sleepers based there. So the focus of efforts and Housing First particularly has been across the central belt, as well as some of the other big cities in Scotland where rough sleep is more likely to occur. This past few months, as everything's being impacted by COVID, there was a great effort in the early days of lockdown to move people who were rough sleeping, homeless, at risk of homelessness, into safe accommodation, so they're able to isolate properly. So that means at the moment there's about 14,000 people in temporary accommodation across Scotland, with hundreds of those in hotel rooms, which is good that they're not sleeping rough, but there's also lots of negatives and kind of urgent issues that come in the back of that. There was also a stalling across the whole country of allocations of house building, of upgrading, which just put a pause on the throughput of people getting out of homelessness, because the numbers weren't slowing down in terms of people becoming homeless. It was in fact keeping going. So it was just adding up and adding up and adding up. And there's also a massive reduction in void properties, so a lot fewer than was predicted and forecast. In Scotland, we have a system that's well regarded in terms of its rights, the legal facilities we have for homelessness and housing and support. There is strong collaboration across local government, national government. People are pulling in the same direction. Compared to international rates, we have relatively low levels of rough sleeping. But one issue that we do have is people staying too often in temporary accommodation and for far too long. In the past few years, there's been some key policy developments to end homelessness in Scotland. So back in 2018, there was an action group set up, the Homelessness and Rough Sleeping Action Group, which looked at 4 key questions about addressing and ending homelessness in Scotland. From that came about 70 recommendations that were accepted by the government. They were put into an Ending Homelessness Together action plan across all of Scotland, which was updated this year following the action group being reconvened in light of COVID. There are also 32 local rapid rehousing transition plans. What they are is every local authority in Scotland has now a 5-year plan to transition from the system they have currently to one that focuses on rapid rehousing with Housing First for those that need it. And thirdly, there's a Housing First national framework that I'll touch on at the end of this presentation that we've been developing the past few months, which sets out a kind of 10-year framework for how Housing First can be scaled up as the default for people with multiple and complex needs across Scotland. So the intention of all these policy ideas and developments is to, first of all, prevent homelessness where at all possible, to ensure that when somebody does experience homelessness, that the solution is rapid. They're rapidly rehoused into ordinary settled housing as part of a community, and to focus on reducing the time and scale of temporary accommodation, reducing the number of facilities and reducing the use of them as well. And having Housing First at the heart of that as an urgent measure to address disadvantage that people experience. That graphic on the right is something we put out time and again, because one thing that we get challenged on with Housing First is that it doesn't fit everybody. It's not a panacea, and we get that. That's absolutely the case. But what has been the case over the past decades in Scotland is that there has been a group of people who have support needs and issues that they've consistently fallen through the net and haven't been kept, and they've just cycled through the homelessness system time and again. And it's for those people that have the highest level of support needs that Housing First is for. For the rest, rapid housing should be enough. Some people will need just a house, and that will be the end of their homelessness. Back in 2018 as well, when all those policy developments were getting underway, we facilitated a campaign called I We Can. We went around Scotland and spoke to 425 people that had direct and lived experience of homelessness and rough sleeping, to ask them about their experiences, their views, and what they would do to fix the system, to make it better, to make it more effective. And these are the key things that came back from those discussions. Housing First and fast. A number of times people said, if I had a secure home with a locked door, that would be a huge step towards ending my homelessness. Joined up, from the experience of people who are experiencing homelessness, that they recognised that services weren't joined up. They'd have to go to one place and tell their whole life story and then get sent somewhere else to do the exact same thing. And services weren't talking to each other, agencies weren't working together, and there was lots of separate things happening in separate places. They asked that staff be better aware of some of the reasons people experience homelessness, some of the backgrounds that lead to people experiencing homelessness, some of the drivers, including child poverty, just so there's a more compassionate response to it. They wanted it to be stopped, so prevented where it can, and they were recognising that point that homelessness comes late in life after quite often a series of traumatic and challenging experiences. There is a need to count it, to understand what issue you're dealing with, and speaking in a Scottish context, this isn't always perfect, quite often far from it. We don't have a clear sense of what the numbers are, city to city, area to area. And lastly, and pertinently for this presentation, was to collaborate. Again, there was a recognition that the services and the people they were working with weren't collaborating with one another. So you had this broken system that was disconnected in so many ways. So that fed into the recommendations and the Ending Homelessness Together action plan I referenced. So Housing First, it's normal. It's people getting a settled home and the support they need to live and build a happy life. It's fairer, it's equitable for people who have, like I said, slipped through cracks and cycled through the system for decades. And it works. It works internationally. It's working in Scotland. And that last point, we all benefit. It's not something that just works for those working in the homelessness sector. It has an impact on health services, on justice services, on communities, on housing providers. So it's something that necessitates and benefits from partnership. Getting to where we are in Scotland has taken a bit of time. Started in 2010 with a pilot in Glasgow looking at Housing First, which was a success, a relative success, but with 40 to 45 people over 8 years or so. That led to the planning and policy that I was discussing. And then in 2018, there was the ambition to, okay, now we've got about 100 tenancies. How do we scale that up to the need that Scotland has? That led to the idea of the Pathfinder, which was to operate across 6 local authorities to take away some of the big challenges like funding and housing and say, okay, what are the softer things you need to consider if you're starting up, scaling up Housing First. The graphic on the right is kind of the steps that was taken. It was, first of all, it was sized up as an option. All the planning and policy was tuned up to make sure it was possible. This stage we're in now is trying to ramp it up. Alongside this goes evaluating and reviewing what's happening, how well it's happening, with the long-term ambition that Housing First in Scotland is just the default for people that need it. So to date, with the Pathfinder, like I said, 6 local authorities, that's Glasgow, Edinburgh, Stirling, Dundee, Aberdeen City and Aberdeenshire. There are 5 consortiums of support providers, so 1 for each of those areas, and 15 support providers feeding into those, 25 plus housing providers providing housing to the programme. By the 30th of September, at the last count, there were 327 people that had been housed via the Pathfinder, an 87% sustainment rate, which was in the 90s before COVID hit and stalled things for a few months. So that's been a really positive outcome from the past couple of years of work, and just a lot of learning, just day-to-day micro things, bigger things. I'll try and pick up on some of them, but as well as that, I'd love to talk to all of you and answer questions as much as possible after this. So to expand the example of the partnership need, to take the Glasgow City, for example. In Glasgow, there are 4 support providers within the consortium. There are 67 housing associations in Glasgow because the local authority doesn't own any of its stock. It's the biggest authority in Scotland. Also involved in the Health and Social Care Partnership, community casework teams, case managers, addiction services, mental health services, community justice, the Department of Work and Pensions, police, elected members of business community, and so on. So all of these bodies and agencies have a vested interest in ending homelessness, and as part of that, working with Housing First. And what we've learned over the piece, this one's probably been the biggest frustration, is at any level, however long you plan for it to take or you think it will take, it takes longer. So if you think it's going to take 3 months to set up that multi-agency group, it's going to take 6. If you think it's going to take 6 months to get 50 people into tenancies, it might take 12. It just, having that many different people coming from different environments and perspectives working together takes time, which makes it extra important to invest early doors in that shared understanding of what you're trying to get to, because that will mean that once you do get going, you're working from the same page. It's better to do that than to rush it. Risk came up as a question and a challenge for us in the past couple of years, namely that risk means different things to different peoples. And this is of particular note when you have multi-agency groups that take in statutory bodies, public bodies, charity organizations working together, because their obligations, and in the back of that, their understandings of risk and what they can and can't do are different. So you may have people that want to push and drive things forward, and people that for very valid reasons can't do that. So one thing that happens is when you get groups coming together and starting to work, the frustration of another person seemingly blocking the process is kind of very obvious and immediate. So being able to talk through that and understand where each person's coming from, what their perspective is and what their environment is absolutely key. Language versus practice. I'm sure many of you have conversations in your organizations and sectors about the language we use, how we talk about our work, and that has been quite an interesting one, because sometimes language goes ahead of practice and sometimes practice goes ahead of language. One example we had up here in Scotland is that people were doing Housing First and saying all the right things about leaving behind the idea of people being tenancy ready, housing ready, and yet in practice those old habits were built so deeply into the system that people were still being assessed as, oh, they're not quite ready for Housing First, they're not going to benefit from it, whereas we're pushing the evidence that says Housing First. You try that first, and if that doesn't work, you have another option for a person, but you can't go into an assessment or a support process saying, oh, this person, I judge them to not be ready. This one's, I mean, it's fairly stark and obvious. Relationships are key. you're going to have people working together, and personality clashes can break down full processes. Again, spending time early doors to understand where each person's coming from and making sure that the goal that you have is the same, that's fine. If you've got some flexibility in the steps you take to get there, that's fine, but have a rigid vision as to what you want to get to in the end, because that goal is the same, be you coming from a local authority perspective or a frontline support perspective. You want to end homelessness and have an effective outcome for the person you're supporting. Buy-in at all levels. The reason I mention this is that when you've got partnerships and you've got multi-agency working, if you've got, take for example, 5 partners around the table and a decision needs to get made, and 4 of those organizations have the person at the table that can make that decision and one doesn't, that just leads to delay. So making sure that you have the right decision makers buying into the process from the get-go will make things smoother and easier to push on. There's also a second point to that, which is when it starts to get implemented, it's no use to have buy-in from managers and at a strategic level only for the people that are tasked with doing the job to not understand what it is they need to be doing, because they're the ones at the end of the day that carry this on their shoulders. So you can have commitment and buy-in at a high level, but if you don't have the staff themselves bought in and understanding what they need to do, then it's not going to work, or it's going to take a hell of a lot longer to get going. So some of the things that we learned after the first year, the kind of full annual checkup, and all this stuff is included, I should say, in the framework that I'll share later on, and that people can take and use to find out more and plan themselves. So planning for change, what I mean by this is that Housing First, it's not just something that changes the lives of people who need it, who benefit, but it changes the systems in which homelessness operates, in which people have to navigate. So being aware of that and creating a positive environment that helps that change as early as possible can really make improvements to the whole thing. It's like if you drop a stone in the water and the ripple effect, the way Housing First works and the principles that underpin it, which I think you spoke about last week, they don't always tally up with the principles of how current homelessness systems operate. So there comes a clash, there comes a tension, and the idea is that Housing First, when it's shown to work, can lead to that wider change. Starting an early point to not only work as partnerships in the implementation of it, but work towards joint approaches with commissioning as well. One of the other issues we have in Scotland, and I imagine it's replicated elsewhere, is the tension between Housing First being an indefinite outcome. So the support's there for as long as a person needs it, as much as they need it, versus how support services are currently commissioned, which is on a time basis. So that you rub up against it, and you have to have an early conversation about how that's going to look from the funding point of view. Again, this one is maybe stating the obvious, but measure progress and making sure that from a very early point, all partners around the table have a clear idea of what progress looks like. Having a performance framework, having a learning log, making sure that you're able to check in fortnightly or monthly, however often you meet and talk, to say, okay, here's where we were, here's where we are now, here's the things we need to do next to keep on moving towards the outcome we're trying to achieve. And making sure that the core indicators are as insightful as possible, but also not so detailed and specific that it blocks the work you're trying to do. Working together, the bigger point here is working together early. So taking the right approach to find the right partners in your area. Housing First is very straightforward in its concept. Actually doing it is very complex because it feeds into lots of different organizations, processes, frameworks themselves. So being able to get together to ensure that what you're providing long term is right is going to be critical, and think of that at a very local level. Yes, it can be a national policy, but it's going to look somewhat different depending on what area you're in. Some of the examples of that in Scotland are urban versus rural. The setup in a city looks very different from the setup somewhere like in the Highlands or in Aberdeenshire, where you have people far more spread out, you have fewer support services doing more things. So having to think about that early doors is only going to be helpful. And then a kind of ongoing effort to problem solve, to ensure that you're working together to constantly revisit the things you've put in place, the things you're doing, and be that the end-to-end process from when somebody's referred into your program to when they're finally housed, bringing that to the table every 3 months and saying, okay, which bits of this do we need? How can we speed it up? How can we reduce the time taken for somebody to be housed? That's critical because it needs to be constantly reviewed and refined. Right now, for example, in the Pathfinder, we've got a waiting time between referral and move-in over 100 days, which is too long. We want to try and get to a point where it's somewhere between 4 and 6 weeks. The local authority in Scotland is doing the best of that just now, is at 77 days. So there's lots of work to be done across the board to try and reduce that time, so that when we're talking about rapid rehousing and rapid solutions, that it actually is rapid. It's not just rapid in name only. The Pathfinders, what they have shown is that by doing that, by meeting with governance groups and operations groups monthly, quarterly to scrutinise what they've got in place, that has helped, that has led to progress. I'll touch on it later. Like the length of time taken to house 100 people versus the second 100, it was getting shorter and shorter and shorter, and that came in the back of constant conversations about reviewing what was being done. Yeah, this is the point I was making here. The first 100 tenancies took 12 months to be housed. The second 100 took 6 months. Over the piece, move-in times were reduced, repeat homelessness was reduced, more tenancies were being sustained for longer. You can see in the graphic there that the reduction in waiting times per each of the local authority areas in that first year as well. This goes back to the point I was making about planning for change. I hope this makes some sense, but it's the idea that if you take the rapid rehousing transition plans that I mentioned in each local area, they have a map to get from where they are now to where they want to be in 5 years. That doesn't just include creating this new way of doing things. It also has to go alongside like disinvesting in what went before, pulling away some of the things that went before, and being quite willing and bold to say when things aren't working and stop doing those. Otherwise, what you're going to end up with is that old system plus a wee housing first add-on that will just not work in the long term. So if you imagine the Pathfinder that I spoke about as being like the pioneers here, we're trying to get them to show that housing first works when you work in partnership and scale it up together across Scotland. Then you can have more people picking it up, and you've got those that stabilise the system. And then as that moves into this new way of working, you can hopefully start to kind of remove some of the old clunky bits that were put in place for the right reasons in time before, but aren't suitable now. So in 2018, we had 100 tenancies across Scotland. There's about 500 today. That is still well short of what we think is the total number of people that will benefit from Housing First. So there's a long way to go. There are about a dozen local authorities underway with Housing First in some shape or form just now across Scotland. By April, that's going to be 27. So what's been done in the past few years and the learning that's been shared is to try and make the journey for them as smooth and easy, and ensure that some of the learning from the Pathfinder can be used as shortcuts as well. Just lastly, I mentioned that the learning from the past couple of years is useful, but only if it is collated and shared and available. So we have developed this national framework to start up and scale up Housing First in Scotland, although some of what's in it is not just applicable to Scotland, it can be widely used. What that aims to do is pull together everything we know around Housing First. So the evidence internationally, nationally in Scotland, the policy context within which Housing First is being pushed and in which it operates, what we have learned practically on the ground from the Pathfinder areas and the consortiums, the equalities considerations that need to be taken into account, and then finally a live section for partners to use and to take day to day to help them start up and scale up. So that looks at some key partners like support providers, housing providers, local government, national government, health, and those beyond the homelessness sector. so that from each of their perspectives, they can take from this framework what is needed for them to push it. So I'll share the links for these, and I'd welcome any feedback that you have on them. It's out for consultation as of today until 31st of December. And the purpose of that is to ensure that when it is finally published in full, it is relevant and actually useful to people in different perspectives. Before I finish up, just to sign off with Mick, who is one of the people who was housed in Glasgow via Housing First about a year and a half ago. And he says it better than any of us can, is that Housing First works. One of the guys in you got a flat, no one has been back to the homeless. But more than that, it's now Mick and family. So thank you for listening. I am more than happy to talk and answer any questions that you have, whether that's just now or via email after the fact.
Brilliant. Thanks for that, Doug. I think that was really interesting in terms of what's happening in Scotland, and obviously the scale of the work that's going on up there in terms of multi-agency and getting people together. And I think generally that's something that Scotland does really well across the board, not just in Housing First settings, but across the board. There's a couple of questions that came in, and then I've got one or two as well. And if anyone else has any questions, feel free to drop them in the chat and I can try and pick them up. Someone asked, has like the model of sort of working together with different agencies and different organizations helped reduce the stigma of homelessness, but not just homelessness, so things like addictions and mental health that quite often come alongside homelessness?
A good question. I would say that to some degree, I think there's still a long way to go with that. But what does come from working in partnership and multi-agency working is people are exposed to different perspectives that they weren't previously in different systems. So for instance, those working at a statutory level will be exposed to those who are working in the third sector and frontline, who can give some more context to the people they're working with, the purposes, the reasons behind homelessness, etc. So I say that just organizationally, people working together exposes others to new perspectives and reduces stigma somewhat. There's a big, one of the things that's helped up here is that the Pathfinder that I spoke about was catalyzed in part by an organization called Social Bite, who you might have heard of, doing Sleep in the Park events and lots of fundraising and that, and they've got a very good level of public engagement. So that's a necessary route to try and reduce stigma. And the more you can point to something that works and the more you can normalize it, that has an impact. I mentioned the point about language and practice and how we talk about homelessness, and even using the word and the label homelessness, it has the effect of kind of otherizing. So trying to do less of that as we go is crucial as well. So I mean, that's a bit of a woolly answer, but my short answer is to some degree it does.
Brilliant, thank you. And then you touched on it briefly. You said obviously there's a different context in rural settings and urban settings. Would you just be able to give a bit more detail about how Housing First has played out in rural settings? Yeah,
so there typically is it's less likely to have rough sleeping at a high level in rural areas. So some of the issues are a bit different. Some of the challenges are different as well. You'll have things like transport being a significant issue for support. So some of the things we've seen happening in rural areas are, whereas in cities will have a very small ratio of support worker to those that are supporting, it might be 1 to 5, 1 to 6. In rural areas, that might be 1 to 8, 1 to 9, to ensure that people can get in touch with those who are spread out across a wider area. You'll also have some providers picking up more responsibility, whereas in an urban setting, you could have a referral into a mental health service or referral into an addiction service. You might have fewer support providers in a rural area providing more of those support services. There'll also be the very real issue of housing availability in a rural setting. So one thing that's happened in Aberdeenshire is the people were moved into temporary accommodation with the intention of flipping that to permanent when possible, to ensure that the person could be housed and homed as quickly as possible, maybe in a temporary setting, but then it could be made into a settled tenancy in the longer term. So those are some of the issues that have come out. We are trying to pull more, and a rural group's been set up to have those discussions, because much of the learning, understandably, so far has been in that more kind of citywide setting.
Mm-hmm. Yeah, I think that's something that's replicated in England as well. I don't think that's an issue that's unique to Scotland. I'm just having a look through the chat, and Ray, who's one of our panelists later on, has said sort of one of the biggest challenges in London is sort of agents, landlords, and rents. And again, I know for a fact that that's an issue in Edinburgh, and I'd assume so in Glasgow as well. So how do you sort of maybe like help deal with those issues, like landlords and maybe rent issues and agents and agency fees and everything that comes along with that?
Yeah, that's a really topical question. Much of what's been done so far has been via housing associations with social housing. There have been a few instances of the private rented sector being used, and we've got a couple of social lettings agencies up here that kind of help do that. That you mentioned the point, Joe, about Edinburgh. I mean, they've got a lot of private tenancies that are usually reserved for Airbnb and the festival and such. One interesting development of the past few months is that none of those could get used for the festival because the festival wasn't happening. So there's been a bit of work with, I think, Crisis and the council in Edinburgh trying to look at the private rented sector more and how you can access it better, because the issue beforehand was, as I imagine it might be in London, the significant costs of accessing the private rented sector. What happened in the past few months with some of the emergency measures put through by the government was that there were more affordable properties available. I suppose, I don't know what the context exactly is in London. The issue we have here is that we tend to think of landlords as people that own like 20, 30 flats. The reality up here is that you have lots of people that have maybe one property, and they don't really know. Again, it comes back to that stigma thing and that understanding. You'll talk to them about maybe offering their property for housing first, and they'll be, oh, I'm not sure that I want somebody who could be antisocial behaviour. And you're like, well, that's not the case, and you have to have the conversation. So one of the things that's been helpful in the Pathfinder is having that early work between housing officers and support workers, so they can have a conversation with people that is just a bit more in depth, that they can answer some questions, they can talk through some of the context and alleviate concerns where concerns don't really need to be there sometimes. But overall, the private rented sector is still very much in its infancy as an area for us to use housing first up here.
Cool, brilliant, thank you. And as well, I think just following on from that, like, are you, obviously it's in its infancy in the private rented sector, but do you feel you're maybe starting to get some traction with that? And are you able to sort of encourage housing providers to allocate property specifically for housing first?
There's some traction. We're still of the view that to scale up at the rate we want to benefit the number of people that we think need housing first, it's going to be through social housing and local authority housing far more than it will be private rented. It should be there as an option, if only to expand the options available, particularly when you get places where people want to stay but there isn't social housing available. You might have affordable private rented sector properties there. That then comes to whatever governance setups you have in a local area. So we have in some of these areas allocations groups that meet fortnightly or monthly, and it should be on them to understand where the options are to engage with whatever forums there are for landlords, and if there are social lettings agencies available to be able to have in front of them a kind of wide view of the options available, to then have the conversation with people who are being referred into the programme.
Cool, brilliant. From the chat as well, someone's asked sort of, how would you suggest tackling resistance with certain professionals? So blockages in sort of lack of communication, especially in regards to severe matters.
Yeah, there's always resistance. And sometimes you can't really understand what the resistance is for or where it comes from. You have people who are dyed in the wool of old habits. You have people who don't view it as the likely outcome. You have people that are just stringently against it because they still believe in people need to be tenancy ready. I'd say the thing that's helped us is a conscious effort to have like community events as much as possible. So we've had a series of connect events which bring together people from across the country to talk about what's happening, what the plans are. We have an annual conference year to year. We have newsletters. We have a monthly tracker that goes out that shows what the increase is in the number of people being housed and the sustainment rate across all of Scotland to try and make it as transparent as possible. And then also just trying to engage with as many different perspectives as possible. So like I said, locally, there are operations groups, governance groups, also at a national level, there's an advisory group for it as well, trying to tie into different sectors. The best way to break down resistance, as it were, is to have a conversation with a person. Because I mentioned it in the presentation, like Housing First, it works. And then for us now, it's not even just a thing of it worked in Finland or it worked in Canada. We can point to it happening on the ground in Scotland and say, look, it's working here. And we can link into any number of people to speak with them to find out more about it. And then as with any conversation like that, you have to first understand what the person's issues are, what the resistance is. And there might be valid reasons for it. So for instance, one of the things I referenced was local authorities have quite understandably a very cautious view of risk and what they can do because they have statutory obligations that people in the third sector don't have. That can be seen by some as resistance and deliberately blocking it. But then when you have that discussion over months about, okay, actually that's just the constraints that they work in, that's where they're coming from, they don't have a personal vendetta against it, you can start to just work together and break them down slowly. What I'll say is that it doesn't happen immediately. And even to this day, we still kind of feel sometimes like we're pushing against the tide, even though we now have a Pathfinder that's scaled up and working effectively. And we have 32 local authority transition plans. It's still not the case that everyone's bought into it. So it's a thing you have to kind of keep at.
Mm-hmm. Brilliant. Someone asked as well, have you supported under 25s? So I guess young people, because I think Rock Trust, who are based up your way, have a specific Housing First program for young people.
Yeah, so people have been supported under 25 across the country. That specific example is the perfect one to pick. The Rock Trust, who are based over in the east, have they were already working the Housing First for Young People program. As part of this Pathfinder, they've got a Housing First for Youth element to it as well, and they are feeding into the evaluation and the review to understand what differences there are for people coming through who are under 25 who then take up a house versus Housing First. And we're going to try and find that out as we go, and it's referenced again in the framework for people who want to refer into.
Brilliant, thank you. And for the person who asked that question, I'd also recommend just getting in touch with Rock Trust. They're really approachable as well, and they're a really, really good organisation. So don't feel shy about getting in touch with them as well. You can say we sent them. We can say that we sent you. Someone as well asked, just do you know how long it's taken for people to be rehoused during the current pandemic and the current situation?
Yeah, I can't speak in exact detail to it. It's obviously delayed because people have been moved into temporary accommodation and hotels, and allocations were paused for a number of months. So there are still, for instance, in Glasgow, I think around 550 people in hotel accommodation that were moved in back in March, April, May. So that's an urgent need to move them on for the primary reason that it's not good for them to be in a hotel for that length of time. But secondly as well, like if you're talking about the cost element of Housing First, one of the things we push time and again is that it benefits costs across the board. You're looking at millions and millions of pounds being spent month to month to have people in hotels. What I'll say is we measure via the tracker for the Pathfinder the length of time between someone being referred to moving in. The average for that, like I said, is over 100 days just now. The average for people who are housed in September was over 300 days. So there was just a significant delay in them being able to get moved through because of that time period between March and August where things basically shut down. So that's just I can only speak to the example in the Pathfinder. I can't speak to it across the country, but it certainly had an impact.
And again, I think that's an issue that's not unique to Scotland. We're seeing that across the board and across the four nations. One last sort of question for me, and it's a biggie with no necessarily easy answer. You touched on, obviously, with Housing First models, there being a disconnect between the funding that's needed and the length of time that's needed compared to traditional commissioning models and everything that goes along with that. Sort of just how have you approached those conversations? Because again, I'd imagine it's something that's an ongoing conversation that takes time and has to constantly be revisited. But just sort of how have you approached that? Because I'm thinking there might be people who are dialing in who have to have these conversations with commissioners or local authorities or whoever it is, and they're just maybe struggling to get that message across, or they just feel that they're having to constantly repeat it.
Yeah, no, that's spot on. The first and best approach is to prove that it works in the long term and that it's going to save commissioners money in the long term. There is international evidence for that. We're trying to build that up with our evaluation just now in Scotland, so you can show that whether it costs £5,000 to £8,000 per person per year in a tenancy, if you take that against temporary accommodation, which might cost £25,000 per year, there's a significant benefit. The second piece is trying to get plans in place and making that effort that plans are long term. So you have, for example, like I said, 5-year transition plans per local authority. So they're thinking not just a year or two ahead, but 5 years ahead. This framework set out for 10 years, trying to say that that's what it will take to get to where we might want to get to, so we can slowly move people's thinking towards long-term planning as opposed to short-term planning. There's also the political element. So we had a session at one of our conferences recently, which had members of each of the political parties talking about Housing First and having all of them bought into the idea as something promising. So if you have that, then you can move towards potentially a kind of 10-year goal or a 15-year goal without the worry that it might get derailed by changes in government. So that there are a number of parts to it, and it's a conversation that you need to keep having, and I'll say a conversation that's not yet been resolved up here. The Pathfinder was always intended as, so there was funding from some key funders, there was housing pledged from housing providers across the country, so it was taking those big challenges away and saying, okay, now how do you scale up? What are the softer questions that come out of that, and what are the benefits that come out of that? So we could point to it for local authorities and say, look, here's some reassurance that it works. It's going to be an effective solution in your area. So A, take it up and commission it, but B, start to look at it as not just a service you commission for a year or two, but something that might be 5 years, 10 years.
Brilliant. Yeah, and I think that's absolutely key. It's about trying to make people look at the longer term and the bigger picture, which is easier said than done in some circumstances, but I think commissioners are willing to listen, especially when you start talking about money and saving them money. I haven't got any more questions, so Doug, I think that was absolutely brilliant. Thank you.
Thank you.
What we're going to do now is I'm going to suggest we just take a break for 10 minutes just so people can get a drink, put the kettle on, and we'll come back at 11, and then we'll hear from Ray and Lauren at SHP. So if people come back for 11, and then we'll get on with the next session. All right, cool. So welcome back to everyone. I hope people managed to stick the kettle on and get a tea or a cold drink if you're not inclined to warm drinks. We're gonna, when Lauren and Ray are ready, we'll hand over to them to present. They're from an organisation called SHP, based in England. I'm sure a lot of people would have heard of them and the work that they do. And they're just going to talk about a project that they have running called the Team Around Me project. But we'll just wait a minute for Ray to be ready, and then we'll start with that.
Okay, let's do this.
Brilliant. All right, just I'll get your presentation up and then we can go. So Ray and Lauren, over to you.
Thank you, Joe. First of all, Doug, thanks. That was really interesting, actually, to hear from Scotland and hear about the similarities and the differences, I think. So as Joe mentioned, me and Ray are here today to talk around the Team Around Me case conference tool. I guess in its simplest form, it's a strengths-based case conference framework or template that can be used for multiple agencies to come together to discuss a client. And we've definitely used it in housing first situations. I guess we'll start by introducing our project a little bit. So we are FLIC, which stands for Fulfilling Lives Islington and Camden. It's lottery funded and it's managed by SHP. It was commissioned in 2014 to work with people experiencing multiple disadvantage across Camden and Islington. And our approach hopefully is really person-centered, trauma-informed, sort of relationship-focused. And we do frontline work with our services coordinators working directly with clients. But then we also have a system change approach, which means that we sort of focus on working with the systems around us and the services around us to sort of spot gaps and hopefully change for the better the service offer for the people with multiple disadvantage in those two boroughs. So it's kind of like a two-pronged approach, the direct client work and hopefully learning from that, the system change work. And we also have a housing first within FLIC, which is what we've learned from as well. So my name's Lauren. I'm the operational development manager, one of them. And Ray, do you want to introduce yourself?
Hi, I'm Ray and I am the deputy manager.
Thank you. Okay, great. So if we can have the first slide, please, Joe. So I think like from the beginning, we've really had quite a gendered approach at FLIC. 50% of our caseload are women. Our caseload is made up of people who are experiencing multiple disadvantage within the boroughs of Camden and Islington. And 100% of the women referred to us at the time had unmet needs in areas of homelessness, substance misuse, mental health and offending. And as I said, from the beginning, we sort of noticed this particular need of women that was really unmet by existing services. So we've worked with 44 women between 2014 and 2020 now, and a further 7 supported by Wiser and a further 5 by the Solace pilot. So quite shockingly, although I guess somewhat something that we'd expect, is that 90% of the women that we have worked with have experienced gender-based violence or abuse either currently or in the past. So that's a really, really high percentage, obviously. And that's just of people that have disclosed to us. So we can only imagine that that could possibly be higher. So that's obviously a really defining feature of the women that we do work with. 0% of the women referred to us were receiving specialist support at the point of referral. And also 66% of the women that referred to us had safeguarding alerts or repeat MARACs due to domestic violence and abuse. So again, this was really noticeable as a common theme in terms of the women that we were working with and an unmet need. And really sadly, we did have one woman that we were working with that died in DVA related circumstances. Thank you, next slide. So as I said, from the beginning, we've really had a gendered approach to the work that we do. Like I said, the client work that we do really informs the system change work that we then go on to do. And we really want to influence service design and delivery to better meet women's needs across these two boroughs. So firstly, obviously, we have an innovative cross-sector response. That's our project. We've also worked with Solace on a housing first pilot for women, and the Wiser project, which is a specialist WARG project supporting women experiencing domestic violence and abuse. We've also got another strand of our work, which is around piloting a multiple disadvantage rep at the MARACs. Ray is actually the multiple disadvantage rep at the Camden MARAC. And the point of this is to really get that specialist advocate in that setting. Like we said, with 66% of our women going to MARAC frequently, we really noticed that there was a gap in the sort of actions and outcomes for women with multiple disadvantage. And so Ray's role and the MD rep role is to improve support and action planning for those complex cases at MARAC. Another strand, something else that we've been working on, is the hidden homelessness of women. So recognising that women's homelessness often isn't counted in traditional sort of methods. So we're undertaking a research project with the University of York to better understand and quantify women's homelessness using cross-sector data. So really investigating women's housing history, understanding where their homelessness comes from and what are the driving factors. And another strand that we're working on is work around perpetrators. So often we're working with women whose perpetrators are on the scene, women who are still with their perpetrators. And that obviously is a really tricky and delicate but important piece of work that's often done by frontline homelessness staff. And we recognise that there was a lack of guidance and sort of good practice in that field. So we're hoping, well, we are developing guidance for staff supporting women in homelessness settings who remain with their. So that's a lot of our system change work that is very gendered. And we also want to have a big focus on peer-led approaches, developing and publishing models of support, and really embedding co-production in everything we do around systems change.
Okay, so when we're talking about kind of like systems change and systems thinking, like one of the great things that Team Around Me can do is it kind of takes, most importantly, it takes pressure off the client and says, you know, stop saying that it's the client that needs to change, it's the client that needs to access things differently, it's the client that needs to adjust their behaviour. But like often in multi-agency meetings, instead of just putting it all on one service, kind of like thinking about wider systems thinking and all of the systems that affect our clients, from like, you know, the fact that we have a Conservative government at the moment, and the fact that, you know, certain cuts are being made in some places, and, you know, it's very difficult to know where the next cuts are coming from and what services are going to be reduced, and that, you know, going on to law and national policies and commissioning and funding and how that works, and the local commissioning structures, the fact that, you know, third sector charities and organisations bid for tenders, and if they get them, and it depends, you know, what they're paying their staff, what the turnovers are like, that our clients often can't get a relationship going with a member of staff in certain services before that member of staff leaves and they're replaced by somebody else. So that affects them as well. Like how local services are run, you know, if there is a homelessness hub, you know, who's running that homelessness hub, what services are they getting into it, and how they're being provided, and then like the other people that are surrounding that client as well. And like our clients, you know, don't really know where the power to change things is, and we don't really know where the power to change things is. I think, you know, when I first started in this sector and I would be coming up against all these system blockages that meant that my clients were finding it difficult to access services, and trying to explain these to the client, and then trying to explain the client to the services as well. And I think like working for Flick has been so great in so many ways, because it's actually, you know, given the power back to me as a frontline worker, and being asked, okay, where are the blockages in this system and what can we do to unpick them? And there's so much that we can do. Do you know what I mean? Like, I think, you know, in the last discussion, we're talking about, you know, having those conversations with commissioners, having those conversations with services, like presenting case studies, saying, you know, this is an issue not just for this client but for lots of clients, and really starting to think how these systems are affecting our clients and blocking them from getting the help that they need. Thanks. So what is systems thinking? It's a way of helping a person to view systems from a broader perspective, and it includes like seeing the overall structures, everything that is making up that system, and presenting those blockages from stopping that person getting into that system. So, for example, a lot of like multi-agency meetings that I've been in over the years, a lot of the onus and a lot of the responsibility seem to fall on the client. You know, the client will not engage with their substance use worker and keeps falling off the script. So it's about thinking what systems the client is part of, what systems the worker is part of. Is this happening to other clients? Have we asked the client and the worker what the barriers are? Is staying on a script the client's aspiration, or is that something that we want for them? Have they been asked that this is something that they want to do? What can we try and do differently? And so sometimes it's just as simple as their morning appointments and the client doesn't get up till 1 p.m, or, you know, they don't like the worker, or the worker is their perpetrator's worker and they don't feel safe disclosing to them. You know, that there are so many systems surrounding our clients that they are part of, and we need to, it's helpful to kind of like really open our eyes and look at all those systems and the systems that we're part of and the blockages that client's experiencing, and putting our focus not on what the client needs to do, or even, you know, how the services could be different, but looking at it as a bigger picture and identifying those blockages and working together to enable the client to overcome those. Thank you. There's a couple of quotes about systems change for you there. And just, I think they highlight the importance of like good multi-agency working and good practice, because, you know, I've found that either, you know, all of the pressure is on the client to change or to access services differently, or all the pressure is on the individual services, or they're not doing this and they're not doing this. Do you know what I mean? Whereas if we open up and we have those conversations about the blockages, then we stand more chance of overcoming them. Thank you.
So why was the team around me framework developed? I think, like we said, all our sort of system change stuff is a reflection and learning from the client work that we did. So I think most people who do a frontline job will be familiar with those situations where you're working with a person. Initially, in this case, we piloted this framework with women. So you were working with a woman where you do go to multi-agency meetings. They're always the same. They're always stuck. They always are negative. They're the kind of thing that you actually end up dreading going to, because they feel very sort of problem focused rather than solution focused. So I think we recognised that there was this sort of push towards multi-agency work, and people were having these multi-agency meetings, but often they weren't that fruitful, especially for cases that were really complex. And they can often lead the workers feeling kind of negative and stuck. So you can only imagine how that must leave a client feeling. Also, we noticed the same sort of, I guess, feeling at the MARAC. So the cases were being referred, but there wasn't really enough time to discuss the more complex cases. And there weren't really useful actions for those women who struggled to engage with, for example, traditional domestic violence services. Like I said, a lot of the meetings were being held, but there was no clarity or consistency on agenda and minutes and meetings and how the actions were followed up. So it could feel like a bit messy at times. And again, like I just mentioned, the language can become negative, and there was a real need to challenge this sort of default negative language and quite victim blaming language. That's the kind of thing that Ray was maybe alluding to previously, about all the problems were the client's fault rather than looking at the client as part of a system that's holding the client. So we recognised that there was a real need to empower the clients, particularly when talking things about risk and safeguarding and support. That was often something that was seen quite done to the client. So we wanted to look at flipping that and empowering the client to own and discuss their own risks and support needs. We also noticed that there was, as again Ray alluded to, like repeat themes in terms of what wasn't working for clients. So for example, in Camden, this thing might be coming up for different clients and you might have a quick chat about it outside the meeting, but there was no real way of capturing that, those reoccurring blocks and barriers, and there was no way to collate them and better understand them. There was also, and again, I think this is something that Doug was speaking about, an understanding that different services have different remits and different ways of working, and this can sometimes lead to a lack of collaboration, especially if the perspectives of each different services aren't sort of acknowledged at the beginning, and that can cause conflict and burnout, I think, amongst workers, which is then obviously passed on in terms of outcomes for the client. So listening to the clients, when we were listening to the clients about what works for them, these are some quotes that came out. I think the bits that are worth noting particularly are having one person that can navigate that system for you. As Ray said, noticing that the client is going to be part of this ripple effect of systems, that can be very overwhelming, and the client is looking for one person that can sort of be their point of call. Someone to do nice things with, not just to go over the negatives and the problems, and not being told what to do. Often our clients know what they want to do, they just need support along the way to get there. And a few more quotes. I guess this one is really about relationships and doing what works for the clients. I want someone who I can talk to, and that will really help me. Also, I guess someone that is willing to listen, someone who doesn't get shocked when listening to the client speak, and they're maybe quite, you know, they're traumatizing histories and experiences. And something, I guess, about validation and affirmation, having someone tell you that you are strong, empowering that person and recognizing what they've survived already and the strengths that have got them to where they are today. And someone who will stick with you. And hopefully all of this is reflected in the template that is the Team Around Me tool. So what is the Team Around Me? The Team Around Me, very simply, is a strengths-based template for a multi-agency meeting. And it does have also a system blockages aspect to it as well, to help us better understand the challenges for the client from the systems that they live in. So it's a new structure for holding case conferences or multi-agency meetings, and it was created by Flick, our team, and Pause Islington, which is a service that works with women who have had multiple children removed from their care. So we wanted to standardize a structure that holds agencies accountable for actions. We wanted to recognize the strengths and protective factors before looking at the challenges. And having personally attended a lot of TAMs, I think that's something that really, really sets a positive tone and makes it different from other case conferences. The lead professional is chosen by the woman. We do actually now use this framework for men and women because we've had such positive feedback from it. But like I said, it was piloted for women. And that was really to empower the woman. So the woman's worker that they get on with the most, that they feel represents them the most, they can choose that person to chair the meeting. So again, that's empowering the woman and putting a bit of ownership back with them. And then the second part of the Team Around Me looks at system blockages, so problems or issues which are getting in the way of a woman accessing services or achieving her goals, and understanding the responsibility of services, not just the client, to help fix this problem. Action, not problem focused. So guides agencies through identifying and thinking about issues and blockages collaboratively with a solution and action focused mindset. And again, I think that's really important in multi-agency working, rather than putting the blame on different services. It's going, okay, this is the issue. How can we discuss this really openly together to try and get a new outcome for the client? Thank you. So the agenda, we'll go on to like a good practice example in a minute, so you can see what it looks like, but just to talk through the agenda quickly. So it's the name, and then we start off with positive feedback and achievements from the client and the people in attendance, the professionals, like I said, this sets a really positive tone. It's something that doesn't often happen. You just go in, and no matter how dire the situation might feel, you can always pick out some sort of positive, even if it's just that the client managed to nominate someone that they wanted to talk on their behalf today. You can always find one thing, and going around and building that positive attitude amongst the group, something that's shared and positive, is a really good way to start. Number 2, what goals or issues remain? Complete an action plan. So this is basically setting out actions, who, what, when, and keeping it in a template that holds agencies accountable with that to their actions. And 3, system process tool for blocks or challenges. And this is broken down in the following questions. So there's an aspiration. What would the client like to achieve if the system could be changed or unblocked? So in other words, if the system wasn't a problem, what would we have? Block, so what is getting in the way of this happening at the moment? What are the problems, either in the system or at the service level? Reflection, and this is where it's really useful to open it up to all the professionals involved. What are people's thoughts about this issue? And I think, again, this goes also back to what Doug was saying about understanding different services' perspectives and working more collaboratively. Questions, what do we need to know in order to start tackling this issue? Is there anything that we need to clarify? Are there differences in opinions between services? Are there different remits? What does the client think about this issue? So again, really opening up that discussion and holding everyone accountable for coming up with solutions. And then actions. What are we able to do about the issue or the system blockage today within this conference? Or are there any things we can do after the meeting? Who, when, where, and how? And this again is really empowering to think there might be blockages, but there might also be ways that we can tackle this. And we also do ask that people feed back the system thinking process to Flick so that we can start to collate the issues that reoccurringly come up and start looking at them and think about them more broadly. But I guess to really simplify it, it's the person's achievements and positive feedback, goals and actions, and then understanding any system blockages in that situation. So Jo, I don't know if you can get up the good practice template for us. Thank you. So this is an example. I have to say this one is really comprehensive. So it's really full. I think that it wouldn't always be this long, depending on like how you used it. But as you can see, it's just got the person's name, which is obviously changed, then the people in attendance. And then if we scroll down a little bit, we can see there's a review of achievements. So that's where everyone in the room or in Zoom will go around and give some positive feedback, and that's all noted down. Again, hopefully the client is actually there to hear that feedback. That's the best case scenario. If not, if the client can't attend, that can always be fed back to them afterwards. Thank you. And then we can see a bit here for the goals or issues that remain. So this is your kind of typical action planning, problem solving place where you've got obviously people who will do this by when, just to hold services accountable. Thank you. And then if we scroll down even further, see these are all the actions and the goals. And then we get down to the system blockage bit. So if this is the first team around me that you're holding for the client, you may not necessarily get onto the system blockages bit. And I would still encourage you to use the strengths and the action sections of the team around me, because those are the real essential bits. But like I said, if there is a theme that's coming up and it seems like it's something that's out of the client's control and it is more something that lies with the systems, this is where you can begin to break it down. And I have seen this work really, really well personally with cases that feel really stuck. And this system change aspect of it really builds that collaboration between services, really opens up a dialogue, really gets people thinking slightly less defensively about what they can change, and really brings the team together and builds like a network that is ready to challenge the system together. And I think that is empowering for the frontline workers, but also really empowering for the client as well. Thanks, Jay. You can see that all filled out there. And then if there's any actions, you can go away. Here you can see there's 2 blockages, so there might be more than one. Thanks, Jo. And we can send this round as well, the good practice template for people to have a look at in more detail. Go back to the slides.
Okay, so the feedback we've had around Team Around Me has been overwhelmingly positive. Professionals have said it's been working really well for the women that they work with. It encourages attendance by the client. It's useful for collating information. Women feel empowered, feel valued, believed in, and they're in the driving seat. And because of this, they achieve some pretty positive outcomes. It's easy to follow. The client's in control. The client decides they want to attend, and that complements the level of engagement. It's a better format than typical professional meetings as it's client-led. The meeting starts by acknowledging the client's achievements, and she was overwhelmed by how far she had come. As you know, with a lot of women we work with, she generally suffers from low self-esteem. The meeting was extremely uplifting. And like what I've found is if I start doing a TAM for a client, there's going to be actions from everybody. There might be some blockages, like none might have occurred yet. We might just be going through the actions. But what we'll do usually is do the TAMs on a rolling basis, do them every month or every 6 weeks or every 8 weeks, depending on the issues and depending on the risk. And then what we can do is we just keep coming back. And I've had like occasions where my clients haven't been able to attend, but I've printed off the minutes afterwards and I've gone through them with the client. And especially that first page where it says like all their achievements and all what they're doing well, that's really so meaningful for our clients to hear and to see. So I would like encourage it, like not just to be done verbally, but you know, if they're literate as well, to give them the copy, do you know what I mean? So they can look at it in black and white and know that all the professionals working with them are seeing all of the progress that they're making. As Lauren says, there is always progress. There is always something positive to say. You have the next slide, please. Thanks. So where is Team Around Me being used? It's been used in the safe space hostels, which are the safe space lists is in St Mungo's across Camden for their women's lists for women who are accessing their hostels. And I can't explain safe space properly, which is not good. But yeah, it's basically women's spaces in the hostel that are all on a list and are trying to provide some additional care and support in recognising that these women have multiple disadvantage. So we're extending to other hostels. It's embedded in the Safe Space project in Women at the Well, which is a day centre for women who are involved in sex working in Camden. Roots Off the Streets, which is the homelessness hub. 184 is Hostel ICAS drug service. The Camden Marac and the Multiple Disadvantage Steering Group are all looking at the blockages. Like when I'm at Marac, like a lot of the actions that I suggest are, let's have a TAM, do you know what I mean? Like let's have a Team Around Me, and the domestic violence service are using it across their service now, and they're finding that it really works for the women that they're working with, even if these women don't have multiple disadvantage, because it's taking someone who feels very disempowered by what's happening to them and it's empowering them again. And a couple of the IDSLers have got back to me independently to say how useful it is and how adaptable and how they're really enjoying using it, because it's so empowering for the woman who's in that meeting. It's being used across Islington, in Pause, who Lauren mentioned earlier. Solace are using it, and they, the Wiser Project, Our Housing First pilot, are using it. Advanced Minerva, Domestic Violence Agency, Islington Marac. Structure is being trialled for Marac Plus meetings, and workshops are being delivered to advanced services and crisis services in Islington mental health teams. And we've got a lot of opportunities to push this across the Maracs, especially with the multiple disadvantage role. So we all do systems change projects in Flick, and mine was to, because I came from Westminster and I was doing something similar there, was to sit in the Camden Marac and just try and improve some responses for the women that are being discussed at Marac that are experiencing multiple disadvantage, and to be a little more creative around those actions, you know, and to challenge the language and some of the assumptions that people still have around women with multiple disadvantage, like, oh, you know, well, if only she'd involved with get involved with the drug service. And it's like, well, you know, having someone there who can say, you know, she's had substance use issues for 20 years. So I'm sure that's already occurred to her and she knows where the drug service is. But let's think about the fact that just because she has substance use issues, it's not her fault that she's in an abusive relationship. So I want to, like, even that kind of like subtle language that's being used, as Lauren said, to blame those victims does need to be challenged, and structures like Team Around Me just encourage a more strengths-based approach, and they challenge that language and challenge that negative thinking just through their very existence. Do you know what I mean? So can next slide, please. Thanks. There's some resources and links there. I will let you look at those yourself. And next, please. Thank you. So there's been some questions that I've seen that have been asking whether we can supply the format, which we can do. And we can also do Team Around Me workshops for your service. So we can do like a longer training, which is like, Laura and I have done quite a few of them recently, and they're about an hour and a half. So I don't know if they can kind of like fit into team meetings, or you can put together an event for your team, but you can contact Laura, her email is there, or Lauren or myself, and we'll be happy to supply the format that you've heard about today, and also to come along and do a workshop for you if that is something that you would like.
Brilliant. Thank you for that,
Thank
Lauren
you.
and Ray. Before we sort of go into questions and comments and stuff, I'll just say that I can email out those details afterwards to an email. So anyone who didn't write down the email address to get in touch with or anything like that, don't worry, I can send that out. And the resources that are in that PowerPoint as well, I can send them out as well. I can do that afterwards in an email. So for anyone who missed that, don't worry too much about that. You'll get hold of that. Just a quick question from me, just listening to that, and it sounded amazing. I just think it's something that seems really adaptable. It's obviously come from the origins of supporting women, especially in marriage and domestic abuse situations, but it seems that it's a format and a template that is quite adaptable to different situations and not just hostels or women in marriage. How have you guys found that when it's sort of being spread out to different services and people?
I think the feedback's been really strong, like especially, as I said, like the domestic violence service in Camden, Safety Net, when they've been using it with their clients who aren't multiply disadvantaged and are still using it, you know, when a woman is in a situation where she's trying to move to protect herself, and the Team Around Me format is just being used in a three-way meeting with, like, say, the IDVA, the woman, and the housing team. It's still really empowering the woman and putting her in that driving seat. So where else have you used it, Lauren? So I've used it at Women at the Well, I've used in a hostel.
I mean, we've used it definitely with flick clients that aren't women. We use it basically everywhere now, because it is just for anyone that feels, I think, slightly disempowered by their experience of services, which I imagine is most people that we come in contact with. It is really, really empowering, and I think that's that strengths focus and that sort of. What I also really find, I know it is primarily about the client, but I really find that it's really like reinvigorating for the workers as well. Discussion at the end, and it takes away the blame, like we're talking about, where people can get really stuck and think, oh, that service is just rubbish because they won't do this. It really explores it. I think that reinvigorates the worker, which has better outcomes for the client. So I think any multi-agency meeting, really, I don't see why it wouldn't be useful. I think you're right. I think it's really adaptable, even if you're just using the first two sections of it, which is just the strengths and the action planning. That in itself is like a really useful approach for, I would think, pretty much anyone.
I think I've heard in so many multi-agency meetings the kind of, oh, that's just how things are, or you know, that's just how this works, or, you know, well, that's all that we can offer, you know. And actually, I've never heard that in a Team Around Me meeting, because the structure actually calls for more collaboration.
Yeah, innovation as well. Yeah.
And more innovation and more thinking about, you know, what we, and also it humanizes the client. if, you know, I'm just thinking about one of our clients who Team Around Me has really worked for, who we've been working with for quite a while, and, you know, who is a survivor of very serious ongoing domestic violence, who's got homelessness issues and substance use issues and housing issues. And actually all the people that are involved in her case, you know, all the policemen and, you know, all of the additional services, it humanizes the client. They never thought of her as, I'm not saying they never thought of her as a person, I can't judge them, but all I'm saying is their responses to her situation and their actions around her situation, their understanding of her situation improved exponentially after they'd attended a Team Around Me meeting.
And I think it builds that network approach as well around that one person. It really like a network of people working collaboratively rather than everyone coming with their different angles and trying to like defend their ground. I think that's also really positive.
Yeah, someone asked, do you think it could be used or adapted to work with young offenders?
Absolutely. And I think again, like what one of the problems that, you know, marginalized people in society, including young offenders, face is the fact that they do have like low self-esteem, the fact that they don't feel like anyone is fighting for them, the fact that, you know, they're seen as you know, problems,
Yeah.
This challenging behavior, do you know what I mean, and not like trauma responses. And I just think it could be really, really, really empowering, because all of the people we work with have had interactions with the criminal justice system as well. And what I mentioned before about it humanizing the client as well, I think would be really useful in that situation. Lauren does quite a lot of work with young people. What do you think, Lauren?
Yeah, I've definitely used it with young people. And I think also that that idea of understanding why you're in the situation and the systematic side of things, and helping young people understand their place in the system and how they've been disadvantaged, rather than just like, what's wrong with me? That's really like, that really helps people's understandings of their own issues as well. So yes, definitely.
Brilliant. Have you, when sort of running the project and stuff, have you sort of come across any sort of difficulties in trying to get people to sort of buy into that, both in terms of, I guess, service users, but I'm thinking more in terms of everybody around the table, so different services that are involved? Has there been any sort of resistance and pushback to when you're saying, let's take this approach?
Go on.
No, you go on.
Not once you get them round the table.
Yeah.
I think getting them round the table is the hard bit, you know, and actually kind of, I'm trying to push a TAM at the moment, and I'm being pushed back and saying, oh, you know, let's just have it as part of the monthly complex case board, or let's just add it to this meeting that's already happening, or this meeting that's already happening. I'm like, no, I want this to stand alone. I want us to all do a Team Around Me. And I think it's quite difficult, because I'm arguing with statutory services in a borough that we don't usually work in at the moment. So, you know, social services very much have their way of doing things, and, you know, the doctor's surgery very much have their way of doing things. And I'm trying to go in there and push an agenda that they haven't seen before, and all that I can say is, oh, you know what, this works, but it's going to be getting them around the table that's going to be the issue. It's going to be getting them to buy into the idea. But then once that I've done that, I think that people can see that it really does make sense. It really does make a difference.
Yeah, I think sometimes people see the system blockages section and think, oh, I don't know about that. But once, like Ray said, once you get someone around the table and they have that conversation, and they feel how collaborative it is, and how useful it feels, then I think I haven't ever had a problem getting people back to them ever, because they do feel really, really positive when you have them.
Yeah, I think that's brilliant, and I think that chimes with a lot of experience that everyone has. I think it's once you get people around the table and you're able to have a conversation, I think it alludes back to what Doug was saying earlier. I think the power of conversation is it's so powerful, and it counts for so much, doesn't it? I think once you get people there, that's a lot of the journey, isn't it? Like, get people there, and then you've half convinced them because they've showed up at that point, and it's just being able to follow. I also
think a good way in with that is saying that the client has nominated the person chairing, because then it kind of makes them think, well, God, I better go then, because really claim to be client focused and you can't turn up to that, then you've got I think that's quite a good way of getting people's buy-in. It's like the client wants this and the client has nominated their chair. So then people kind of have to come.
Yeah. Someone's asked, has COVID had an impact on the TAM approach?
I think if anything, it's made it more easy to attend. Obviously being online, like you can get to your computer, you don't have travel time and stuff like that. So I actually think in some ways it's made it more useful and more necessary and more well attended, because people can just join from their living rooms. I mean, I guess it makes the ones online might be more difficult traditionally for our clients to attend, but they can still nominate a professional to lead the meeting. I don't know what you think, Ray.
I think exactly the same. I think it's actually made it easier, and I think, you know, there's been more multi-agency meetings and more I've attended more team around me since lockdown than I did the previous year, definitely. And I don't know, I think that's partly to do with the fact that the whole idea of team around me and the whole fact that it works is kind of gathering some momentum. But I also think it's because, as Lauren said, it's just easier to access at the moment.
Brilliant. And someone else was asked, kind of similar to what we were speaking about, adapting it to different services before. Do you think it's an approach that could be developed to work with safeguarding children?
I think that one of the services that have the most so social services very much have their own structures and their own ways of working, and I have in the past found them quite impenetrable sometimes. But I think, again, the focus is always like when we work with, you know, women who've had children removed, and when we work with women who are pregnant, or, you know, women who've had multiple children removed, or, you know, women who are trying to, you know, reapproach their borough where they, you know, had their children removed. I like to think that of Team Around Me as a way to empower those women, because they're often the ones who have, you know, lost a lot of control and lost a lot of say and been really stigmatized, and that, you know, their self-esteem's really been damaged by losing those children. So I've always kind of thought of it as a way to empower the women in those situations, rather than thinking about it from a safeguarding children perspective. I find it really useful when I send out safeguarding concerns around adults to local authorities and they don't get back to me for 3 months. And I'm just like, let's have a team around me while we're waiting. And I think that can kind of really galvanize people. But I've actually never thought about it from a safeguarding children perspective. What about you, Lauren?
Yeah, I mean, I'm not sure I'd want to speak on it too much because it's definitely not my area of expertise.
Yeah, mine either.
But I don't know. Yeah, I think it's for, I imagine, I don't know if they do something like that already, where the child has the sort of, is empowered to sort of pick their professional or something like that. That makes sense to me, but yeah, I'm not sure. I wouldn't want to start saying too much, but that makes sense, that approach, I guess.
I know that, like, looked after children meetings have, you know, the looked after child's input, you know what I mean, and that they're always invited to attend. So actually, I suppose that it's something quite similar that's already happening there. But yeah, it's not our expertise, I'm afraid.
Brilliant. For the person who asked that question, someone did type in that in their experience, the TAC for children is similar to the TAM process. So hopefully that means something to you, because it's not my area of expertise either. Someone else has asked, so, within probation, there's currently a lot of work with female offender strategy, so it sounds interesting. And it could possibly tie into that as well. And I think that obviously alludes to stuff we were saying before about how as well it can tie in with young offenders and different service groups. And the impression that I get, it's definitely adaptable to whoever, whatever services are being used to support a particular individual. I think, correct me if I'm wrong, but I feel you can have as many services around the table as is needed.
Definitely, yeah.
Cool. And then just one more. So someone who was just a little bit distracted during the presentation, just who sort of instigates the TAM meetings? Would it be you guys? Would it be service user? Would it be a mix?
I mean, it would be ideal if the TAM was got to be so well known that the service user could start requesting it. That would be amazing. I think practically at the moment it's usually us that suggests it, but obviously we're really trying to promote its usefulness, and I think definitely other services will get to start to a point where they start initiating the use of it. Like Ray said, we can often suggest a rolling TAM, so like every 6 weeks or something, that keeps people on the ball and gets people familiar with it. And it's also like becoming a more standardized action out of Marek meetings now as well. And I think even Islington Marek, it's now actually their standard format for parts of the Marek meeting. But yeah, you basically as a frontline worker, you can start suggesting it to the agencies that you work with. You can explain it to the client and see what they think about it and give some feedback there. Whoever wants to, basically, but as the person attending this, you can.
Brilliant. I don't have any more questions, and I think that's everything that's been pulled out of the chat. So I just want to thank both Lauren and Ray for presenting that, and also Doug for presenting earlier. I thought they were both really, really good presentations and covering different areas, but obviously linked into the challenges that everyone faces at the minute. Obviously, Housing First is a massive area and we can't cover everything, but hopefully that has helped a load of people out. This is being recorded and hopefully I'll be able to get it up onto our website in the next day or two. And like I said, I will email the links out and stuff to people as well. So if you've missed those, don't worry about it. We will get them out to you within the next couple of days. And as well, we will, in that email, there will be a feedback form. So if you can take a couple of minutes to do that, that would be absolutely brilliant, because any feedback is good feedback. And as well, we do have other sessions coming up. So on Thursday, we've got a bit more of a breakout session, a presentation, but also sort of a breakout session from Turning Point up in Scotland. If anybody knows them, they're sort of been doing Housing First for a long time now. And so we're looking at sort of the issues and using their knowledge around how do you maybe support someone long term, or maybe wind back that service, but also keep into like things like fidelity. And then next week, we've got another webinar session on Tuesday, looking at sort of harm reduction and staff wellbeing. And then next Thursday, we've got a bit of a breakout session, again, just trying to focus in on staff wellbeing, but in particular in Housing First services and some of the difficulties that staff sometimes face in a Housing First service as compared to maybe a hostel service or a different service. So yeah, I haven't got anything else. So I'm going to let everybody go. So thank you for tuning in, and hope everyone has a good rest of the day. Thank you.
Thank you. Thanks for having us. Bye.